In this video clip, we'll talk about the difference between doing lymphatic drainage massage on your own at home versus having someone who's specializing in lymphatic drainage massage and individualizing the treatment to what you as a patient may need. I have many patients that I send to her. Those who undergo detox, especially those with chronic mold and Lyme disease, there's a lot of influx of toxin release that needs to be eliminated. And the lymph system is one of the detoxing pathways that are responsible for this toxin elimination. So many patients want to take the shortcut and do it at home, such as dry brushings, right? Maybe jumping on a trampoline, but they don't really notice that much of an improvement. However, when I send them over to Kirsty, they right away call me and send me a feedback that they feel so much better, that their hip pain was gone instantly, that they can finally see and recognize their legs. So why is that? Let's see the difference.
Yeah, so I love those complementary therapies, dry brushing, trampoline jumping. I really think they are great, not just because they give something for the person to do that contributes to their own wellness, which is such an important part. There's also, there is that movement that we need to help that lymphatic system in between your manual lymph drainage massages. But again, they can't replace a manual lymph drainage massage because the trampoline is really just giving you some up and down. It's not getting the fluid moving to the heart necessarily. It's not getting the entire lymphatic system moving.
So you have to follow the pipes all the way to their drainage point, right?
Yeah.
Because otherwise the fluid just redistributes in different tissues, and instead of seeing the fluid accumulation in the leg, now you're going to see the congestion in the pelvis.
Yep.
So
and I would say too, it's like, could you get toothpaste out of your toothpaste tube just by going like this, right?
Maybe
Jumping up and down. Yeah, especially when it's full, but that stuff on the bottom, you're gonna have a hard time moving that all the way to the top just by jumping up and down.
Right.
Yeah, so I would say that's the comparison for me, is we need to get the farthest things moved all the way up, and that is best done with manual treatment.
Also the individual pain, as they do dry skin brushings, it can be painful, right? So there's going to be some unpreventable resistance on their part to press deeper in a specific tissue. They see that the swelling is there, but it really hurts to go over with a dry brush, where the lymphatic massage can work around that tissue and mobilize the lymph through collaterals to come up.
Yeah, you wouldn't want to do dry brushing if you don't have good skin integrity.
Right.
So that is something that's going to limit that. I will say dry brushing too, part of what I do is also is informing and educating patients and clients that I see on how to best use the dry brush, how to maybe incorporate some jumping with legs apart or on one leg. There's different, or twisting when you jump. There's different things you can do to kind of maximize the effort you're putting in. So you also won't necessarily get that from other sources if you're just Googling it yourself and things like that.
Of course, I think we're more useful than YouTube, but that would be a personal bias.